name is Amanda Ballard. I am a family nurse practitioner student at Maryville University, and this is Brian. Brian, do you need to use the restroom before we start?
No.
Okay. Previously, we recorded vital signs for Brian. His temperature was 98.5. His pulse was 60. Blood pressure 115 over 65. Respiration's 20. His height is 5'11". He weighs 175. That makes his BMI 24, which is normal. We'll be performing a head-to-toe assessment with the cranial nerves throughout the assessment. We're going to start with a neuro assessment. Brian, what is today?
August 14th, 2015.
Correct. Do you know where you are?
Stockton, New Jersey, Hunterdon County.
Okay. Can you repeat 3 words back to me? House, car, lake.
House, car, lake.
Perfect. Do you know what this is?
Pen.
Perfect. Are you able to squeeze your eyes really tight?
Yes.
Very good. Open them up. Are you able to raise your eyebrows? Very good. Can you puff out your cheeks? Like blow air out. Very good. Can you smile? Thank you. Can you stick out your tongue? Good. Do you have any difficulty with smells or tastes?
No.
Okay. We're going to move on to the head and face assessment. I'm going to inspect the skin. I'm going to also inspect the eyes, ears, and skull. I'm just going to feel your head for any abnormalities. Check your ears. Very good. I'm going to have you open your jaw. Close it. There is a little crepitus there, but no TMJ. I am going to also inspect the sinuses. Any pain?
No.
I'm also going to illuminate the sinuses for any consolidation. Very good. I'm also going to check out the eyes. I'm going to look at the eyelids, the eyelashes, I'm going to have you close your eyes for a second. Very good. Open them. Look at the sclera, the conjunctiva for any pink or redness or any kind of drainage. I'm going to check the tear ducts. There is a little redness with the conjunctiva. I'm going to ask the patient if they're having any trouble seeing near vision or away vision.
No.
Do you wear glasses?
Yes.
What do you wear your glasses for?
Nearsightedness.
Okay. I'm going to have you cover your right eye. I'm going to check your pupil. Very good. I'm going to have you cover your left eye. I'm going to check this pupil. Very good. They're 4, 5, and brisk for reaction. I am going to have you, I'm going to have you follow the pen for me. Very good. I'm also going to inspect your eye with the ophthalmoscope. I'm going to get a little close. Very good. I'm going to check the other eye. Very good. Moving on to the ear assessment, I'm going to inspect the outside of the ear, and then I'm going to look with the scope and do some other tests. So I'm going to look at the outside of the ear. I'm going to look at their symmetrical. I'm going to take a look inside. Very good. I'm going to perform the whisper test and then use a tuning fork for bone conduction. Can you hear the whisper equally?
Yes.
Okay. Now I'm going to check for bone density and hearing. Can you hear that equally?
Yes.
Is that equal?
Right side stronger.
Okay. Next, I'm going to move into the nose assessment. Are you having any trouble with postnasal drip or breathing through your nose?
No.
His nose is on inspection, midline. I don't see any position issues. And I'm going to also look with the scope for the nose. Thank you. Alright, moving on to the mouth and pharynx. I'm going to inspect the lips on the outside for any abnormalities and look inside for any abnormalities. Can you say open and say ah? I'm looking at the uvula, the soft and the hard palates. Moving the tongue over to look at all the mucosa. Thank you. I'm also going to move into the neck assessment and check for symmetry and smoothness or any JVD. I don't see any JVD. I'm going to check the trachea, the thyroid, and that all seems to be normal. I'm also going to inspect the lymph nodes. And they're all normal as well. I'm going to palpate the carotid artery, each side separately. Very good. We're going to move to the back and posterior chest. I'm going to have you turn for me. I'm going to inspect the skin. I'm going to check the thoracic configuration for any barrel chestedness. I'm going to also check your kidneys. Does that hurt at all?
No.
Okay. Moving to the lungs, I'm going to look at the respirations, that they're equal and symmetrical. I'm going to check also for the expansion. Can you take a deep breath? Very good. I'm going to also check for tactile fremitus. Can you say Mickey Mouse?
Mickey Mouse.
Good. I don't feel any tactile fremitus. I am going to also palpate for diaphragmic excursion. Or percuss rather. And I'm going to measure to see that there's normal diaphragm, and it's between 3 and 5 centimeters, so we are within normal limits. I'm also going to check for any thrills, heaves, or pulsations. And I'm going to listen to the lung sounds on the posterior chest. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Good. And breathe normal. I I also listen to the anterior and lateral chest, and all lung sounds are clear to auscultation. I am going to also palpate for the apical impulse. Okay, good. I'm going to listen to the heart sounds. I'm going to auscultate for the aortic, pulmonic, Erb's point, tricuspid, and mitral valve. Very good. No abnormal heart sounds. You can stay laying down. I'm also going to inspect the patient reclining. I don't see any JVD also reclining. We're going to move to the abdominal assessment now that we've finished the heart and lungs. I'm going to look at the belly. I'm going to lift you around. I'm going to look at the contour. I'm going to look and see if there's any scars. I'm going to also look for any pulsations or movements in the stomach. I don't see any. I'm also going to check at the musculature, and that all looks normal. I'm going to first auscultate for all 4 quadrants for vowel sounds. All the vowel sounds are normal active. I'm going to percuss the belly. And then I'm going to move into some light palpation followed by deep palpation. I'm going to look for liver borders, spleen borders, for any hepatosplenomegaly. I'm going to check the right and the left kidney, and I'm going to look for any pulsations midline. And have you turn towards me on your side, and you can stay laying. Thank you. Okay, and lay back on your back. Next, I'm going to actually look at the feet and legs while I have him laying down. I'm going to inspect the skin and the hair distribution and the muscle mass of the legs. I'm going to feel for the temperature of the legs, that they're not cool or too warm. I'm going to check for edema in the legs and the feet. I'm going to look at the hair distribution. I'm going to also palpate for the pulses in the feet. Posterior tibial and popliteal. I'm going to have the patient close his eyes. Can you feel that equally?
Yes.
Can you feel this equally?
Yes.
Okay. I'm going to have you open your eyes. I'm going to next have the patient sit up for me, onto the edge for me. Thank you. I'm going to check reflexes. Just relax. Next, I'm going to have the patient hold out your arms. Push up against me. Push down against me. Very good. I'm actually going to have you rest those down. Pull your arms up. Good. Tilt your neck forward and back to the side, to the other side. Very good. I'm actually going to have you lay back down. Can you take your leg and abduct it and adduct it, your hip, and out this way? Okay, put that one down, this one, inside, and outside. Good. Can you pull your knees to your chest and let them go? Very good. I'm going to have you come stand here. Can you squat down for me? Very good. Can you bend at the hips from here? Very good. I'm going to have you stand on one leg and then the other. Very good. Can you bend side to side? Very good. I'm going to have you actually bend forward. I'm going to check your back from the hips. Very good. I'm going to have you take a couple steps forward and turn back. Very good. This concludes the physical exam portion of my video, and I wanted to thank Brian for being my patient and everyone for being my audience.